As India faces a mounting COVID-19 crisis, the Biden administration is pledged to send vital resources to that country. Today marks the 5th straight day India has reported record coronavirus cases with more than 350,000 new infections. And the country has been devastated by its most recent outbreak. India's health system is buckled under the surge, and cases and hospitalizations are overloading, and people are facing widespread shortages of life-saving equipment. For more on this, let's bring in Carmen Paun. She's a global health reporter at Politico and joins us now to talk about this. Carmen, how significant is this decision from the Biden administration for India? And is the help that they are getting from the U.S. and other countries going to be enough to help with what they are facing right now?
Hi, this is the question, isn't it? Whether they're going to be able to get enough support to try to bring the situation under control. India has been asking for the U.S. to lift restrictions on raw materials for vaccine production for at least a week now that we know. And the Biden administration only yesterday said they will. It's unclear how much they're going to release. It's unclear how much India's biggest vaccine producer, the Serum Institute of India, will be able to produce and scale up really fast. The other thing that we also need to keep in mind is that vaccines, people getting vaccinated is not going to be, the impact is not going to be felt the next day. It's going to take a little bit for enough people to be vaccinated to have an impact and for the cases to be brought under control. But definitely, there's been widespread criticism of the U.S. for putting restrictions on raw materials for vaccines. And this is definitely a step in the right direction to help India right now.
So India and South Africa have also asked the World Trade Organization to temporarily relax patent rights related to COVID-19 vaccines and treatments. Can you explain what that means and how that request is being received?
Sure. So in October, India and South Africa asked the World Trade Organization for a waiver on patent rights and intellectual property rules. So in simple terms, the idea would be that pharmaceutical companies that have produced vaccines do not hold, copyright on these vaccines, on the way to produce them, on the technology behind them, so that production can be scaled up and, every company in the world that has the capacity, that has the know-how, can actually produce these vaccines. Obviously, India has a very big industry producing vaccines. South Africa also has capacity, but developed countries so far have said intellectual property rules are not the bottleneck in producing vaccines. We are seeing that right now with India. The bottleneck seems to be raw materials. There's just not enough of it. And those that argue against this waiver say you're actually going to make things worse, because if you have more companies trying to produce the same things, while as the raw materials are just not enough to go by for the ones that have it right now, it's not going to solve the problem. So it's a bit of a stalemate on the issue at the World Trade Organization. The pharmaceutical industry obviously had said, if there's this forced technology transfer, just giving up the patent rules is not enough to be able to set up a plant and start producing vaccines tomorrow. They need to have the know-how, they need to have the capacity. The manufacturing facilities need to be in the right condition to produce this. So it is more complicated than just patent rules, but South Africa and India obviously saw it as one of the ways they could ramp up production and not just wait for the pharmaceutical companies that have develop these vaccines, in many cases with support from governments and from the U.S. government in particular, to produce enough for the world.
Carmen, we have seen heartbreaking images of the mass funerals that are being held in India, most of them, because the country is majority Hindu, as you know, are cremation. And we've seen those images, which might be shocking to some people, but that is generally how people are buried in the Hindu religion in India. But there are so many happening all at once. What are you hearing about just sort of the human toll that it is taking on people who are having to bury their loved ones like this, to hold these services, these cremation services for their loved ones?
Yes, I've seen tweets from Indian journalists saying they never felt a sense of hopelessness like before, like they're feeling now. And obviously these images have been shocking for people around the world. I saw a report of a crematorium worker just crying because he was just overwhelmed by what he was seeing. And, also people trying to prevent their loved ones from dying, people trying to find, a bed with oxygen supply on social media, and other people saying, there are some beds here, but in some cases, obviously, there might be too far away. It's just really, really hard to imagine, the scale of the devastation there and the human toll this is taking. We've also seen people that are working in the cities that are from India's rural areas going back home in the cities and in the states that have imposed lockdown. We've seen last year, too, a similar situation happen when the Indian government imposed the lockdown, and that actually made it worse because it spread the virus in the rural areas, and many experts fear that this is going to happen again. It is really hard to imagine the loss and the grief that people are feeling there, just not being able to help their loved ones stay alive just by having oxygen, and then having to deal with the burden of cremating them when the crematoriums are just overwhelmed.
At the beginning of the pandemic, India was really good at sort of implementing a pretty widespread lockdown. And, you point out that a lot of people who were in the city just went back to sort of their rural towns. And India was kind of like an example of a country that was doing it right. As we watched around the world, as Italy started to reopen, there was a second wave. And so we became familiar with this idea that you cannot let down your guard, that there's a likelihood that a second wave is coming. And it just seems like India was not prepared for that second wave. What happened?
I think you're right. We've seen complacency in many countries that, didn't have, let's say, a very bad first wave, or that managed to bring it down. After a while, people got tired of the measures, or the government wanted to ease restrictions so businesses can come back to a sort of normal, and people can go back to their jobs. We've seen that in India. I remember, I think last November, I was talking to an Indian expert who was saying, people are not really wearing masks here. It's not really so enforced. Things have pretty much gone back to normal. People are like packing the malls and the beaches in some areas. So, as you said, there's been complacency. There was the feeling that, India managed to, avoid the worst, and there was just not enough preparation for what could happen. Obviously, in some cases, new variants may have played a role. At times, it's really hard to tell because the country has to have enough capacity to sequence the infections and to be able to say whether there's a new variant and whether that is producing a lot more damage than, let's say, the other type of virus variants that have been going around. And there have also been political rallies. There are elections in some Indian states. There has been the major Hindu festival that saw people gather on the River Ganges. So all of this have contributed, unfortunately, to what we're seeing today.
Yeah, and speaking of repercussions, the Prime Minister, Narendra Modi, is facing some severe backlash for his handling of the pandemic. The government has ordered social media sites to block critical posts about the public health crisis. That's troubling. What other steps are you seeing as the situation worsens?
So indeed, the Prime Minister has tried to crack down on some dissent expressed on social media. They have asked social media companies like Twitter and Facebook to take down some posts. They are saying that they are creating, panic and fear, and they're spreading misinformation. There have also been some tweets from opposition, some members of the opposition in India criticizing the government that have been taken down. The social media companies have said that they have to analyze that, and they have to see whether the tweets and the Facebook posts that the government is asking to be taken down are really indeed spreading misinformation, or are being harmful, or it's just criticism. In some cases, some of the tweets, for example, in the cases of the opposition members, they are available outside India, but they're not available in India. It's unclear whether this crackdown on social media is going to have a major impact. We saw on Tuesday when Modi was having a major speech and people were feeling that he is now properly addressing the crisis. He is not saying what they're going to do to increase oxygen supplies. There were hashtags trending like stop the speech, not oxygen. It's unclear whether this is going to actually make things worse, that it's going to increase people's anger, that he is focused on cracking down on dissent on social media instead of tackling the crisis up front.
All right, Carmen Paun, I appreciate you kind of giving us a little window into what's happening in India. The situation is dire, and I've said this before, it's a global pandemic. You can't have one country that is struggling without it eventually affecting the rest of the world. So we need to know about it, and we need to do something. Thanks a lot, Carmen.
Thank you for having me.